Okay, well, I'm just going to give just a quick overview. Good morning, everyone. Thank you so much for joining us today, um, especially for this important topic on children's mental health. This event is hosted by Voices for Virginia's Children, as well as partner organizations. As you see that we have elected officials on both sides who are joining us to talk about this important issue. For journalists who are joining us today, this event, as you see, is being recorded. We will provide a copy for you upon request. Also, feel free to drop any questions that you may have in the chat. We also will have a Q&A period after the event is over. Right now, I'm going to turn it over to Amy Strite, who is the CEO of Voices for Virginia's Children.
Well, good morning, everyone. Thank you so much for being here today. What we'd like to do first, if we have everybody's permission, we'd like to take a photograph. So I believe Emily sent out signs if you have them, and if we could come off camera. Any other instructions, Kristin or Emily?
No, that sounds good.
We have it.
Kristin, can you just give everyone a cue, like 1, 2, 3, so then we can all just be prepared?
Sure, yes, okay. 1, 2, 3. And I will do another one for good measure. Let me save that one. All right, and 1, 2, 3. Excellent, there we go. Thanks so much, folks.
Perfect. And Kristin, we do have a request to put the speaker view on instead of gallery view from some of our reporters.
Yes, I see that. I think that's also an option that it'll depend on your computer and the setting you have. So if you hit view, you can choose speaker or gallery up in the top right corner. The recording will be centering on people that are speaking. So, and I can also try to spotlight as we go through for the recording, just to make sure. All right, take it away.
Well, again, good morning. My name is Amy Strite, and I'm the Chief Executive Officer for Voices for Virginia's Children. We welcome you and thank you for being with us today. Voices for Virginia Children is the only independent multi-issue child policy and advocacy organization, and we've been serving the Commonwealth for more than 25 years. Our mission is to champion public policies that improve the lives of Virginia's children. At Voices for Virginia's Children, we advocate on behalf of kids, but the issue of mental health and wellness is one that we turn our attention to on this day. We've heard from kids around the Commonwealth that they are not okay. On top of the very normal and expected challenges of being a tween, a teen, or a young adult, we know that the last 22 months has brought additional disruption, trauma, grief, and loss. Today, we bring together legislators, Senator McClellan, Delegate Brewer, Delegate Coyner, Delegate Price, our speakers, Melissa Gilliam and Annette Alston, as well as our community partners, to say to all youth, we hear you, we see you, and we support you. It's past time to provide the resources for mental health, but we will do all that we can to make sure we deliver those resources now. The Surgeon General and the American Academy for Pediatrics has declared children's mental health a national emergency. We must meet this moment now. It is our responsibility to deliver more resources and more support for children's mental health. It is now my great privilege to introduce Melissa Gilliam, a 23-year-old youth advocate from Farmville, Virginia. She is currently participating in the Voices Advocacy Cohort, and we are grateful for your work and your presence today. So thank you, Melissa.
Thank you so much, Amy, for the introduction into the Voices for Virginia's children's team. I'm so honored to be here, and thank you to everyone else for joining in. I'm going to go ahead and get started now. As defined by the CDC, mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. Mental health is not a joke. Mental health is not a trend. Mental health is not just a hashtag. So much of what you experience as a child influences who you are as an adult and how you function, including learning behaviors and forming habits. Our youth need your help, from passing supportive and vigorous legislation to changing the way we talk and think about mental health. Youth carry so many untold stories of burdens, truths, and hardships, which have only been exacerbated by the COVID-19 pandemic. As a kid, you see what's going on. We might act like we don't, but we do. We see life happen and the struggles our loved ones face, and we internalize those observations and experiences, frankly, because we're unaware of practices to help us process our feelings and thoughts. Or in many cases, our communities lack adequate resources or have extremely limited resources. The just deal with it, you'll be fine, get over it, and suffering must stop now. Resilience is a powerful skill and shouldn't be dismissed, but eventually there comes a time when bouncing back becomes harder and harder to do. The pushing through or dealing with it is simply no longer a viable option. I know this to be true because I share similar stories with countless children and young adults. Whether it's trouble at home, anxiety, depression, or surviving a pandemic, we need help. We need resources. We need access to safe spaces and tools centered around mental health and wellness. Learning to care for your well-being is an essential life skill. Life circumstances will never be perfect, but when we know how to check in with ourselves and check on one another and where to go to receive help, we can begin to transform our lives and ultimately our communities. What better way to normalize mental health than to prioritize mental health and shatter stigmas, especially in marginalized and BIPOC communities? Virginia doesn't have the luxury of not prioritizing this critical matter any longer. Resources, especially because of the pandemic, are in high demand and vital to everyone, but particularly vital to youth. Youth are being told their problems aren't bad enough and they don't meet the criteria to receive services. They're being turned away. Our children and young adults are looking to you and pleading for help. How will you show up? Thank you. And I'll turn it back over to you, Amy. Thank you again.
Melissa, thank you so very much. Senator McClellan.
Thank you and good morning. As a parent to a first grader and a sixth grader, I've spent a lot of time watching my own children, talking to the other parents, teachers, counselors, members of the community, and one thing has become clear. Unfortunately, our kids are not okay. And now is the time to act and to tell them we understand and we want you to know that we have your back. Before the pandemic, 1 in 5 children in Virginia had a diagnosed mental health condition, from ADHD, depression, or anxiety. During the pandemic, studies from the Kaiser Health Foundation have showed that 30% of parents reported that their child's and their own mental health has worsened. To prove that we have our kids' backs, we need to put our attention and our resources into addressing children's mental health. In many parts of our state budget, kids don't get their fair share. That is especially true now, and we have to provide children's mental health services to meet the growing demand. Out of a total of $738 million for mental health services at the community service boards and programs administered by the Department of Behavioral Health and Developmental Services, only $64 million is dedicated to behavioral health services for children and youth. Less than 10% of the system-wide budget for the state behavioral health system. That is why I'm introducing budget amendments this year that invest more resources in our student and children's support services in our schools and to connect schools, including a $10 million amendment for the Department of Behavioral Health and Developmental Services to create a pool of funds for schools to use for clinical level mental health services, and a budget amendment to lift the cap on state funding of support personnel, which includes our behavioral and mental health specialists and social workers in our schools. It is time that we address the needs of our children now, before they grow and before they spiral out of control. We have seen it before the pandemic, and we have seen it get worse. We cannot afford to wait. And I'll turn it back over. Thank you.
Thank you so much, Senator. Delegate Brewer?
Good morning. I'm so glad to be with you all today. I'm so thankful for all of the leaders in this room. And most importantly, I'm so very excited this year to serve as the Commission on Youth Chair. This year, with my service on the Commission on Youth and Behavioral Health Commission, we're working on many systems level challenges about providing mental health services and all the issues we need to address, especially the learning loss and children that have been unduly affected during this pandemic. Before this pandemic, we had a shortage of psychiatric providers, where only 5 localities across our Commonwealth had a sufficient supply to serve their needs. That number only continues to dwindle. And now Virginia ranks 41st in 2021 for mental health workforce availability. So this year, that is going to be our goal, to make sure that we address those issues and make sure that during this pandemic and long after, we address the needs of children. And we're also addressing the mental health shortcomings in our Commonwealth. Thank you for having me.
Thank you, Delegate Brewer. Delegate Coyner?
Good morning. Thank you for all of your advocacy work. I'm extremely passionate about helping our youth who are working hard in recovery for substance use disorder. In 2020, I was able to get a bill passed to start the first ever recovery high school in Virginia. We had funding in place in 2020 for that innovative high school approach, so that our children in Virginia who desperately need support from behavioral health needs in their recovery don't have to drop out of high school in order to receive those much needed supports. What we saw, families were having to make tough choices between much needed long-term recovery support and graduating on time. This innovative approach was funded in 2020, but when the pandemic hit, that money was stripped from our budget. So we have an opportunity this year. I have a budget amendment in place to put that funding back in so that we can pilot the first ever recovery high school in the region, and then take what we learn from this pilot and share the success across the Commonwealth so that all children and families can be served. No child has to make a choice between receiving the help that they need substance use disorder and graduating on time. Thank you.
Thank you, Delegate. Delegate Price.
Yes, good morning, and thank you for the invitation to join you today and for this work for our youth. Thank you for all that you're doing to make sure that our children feel seen and heard and get the help that they need. It's important for me to underscore that mental health setbacks can happen to anyone and everyone needs help, but we also must address when there are disparities. And right now, girls and LGBTQ+ students are more likely to express mental health concerns. In Hampton Roads, where I live, the wait list for services is getting longer and longer, and that's not helping students who need help to get back on track. They are not able to concentrate and learn and live up to their potential while waiting for the services they need. According to the CDC, across the nation before the pandemic, white children were more than twice as likely to participate in mental health treatment compared to Black children, and about just about twice as likely as Hispanic children. This is due in part to contributing factors like eligibility criteria for health insurance and accessibility for services, which become systemic barriers to participation of Black and Latino students. Access to services is important because when students don't get the help they need, it can create even further issues in school. These issues, instead of being treated by law enforcement and referrals to law enforcement and potentially escalating and exacerbating the situation, we should be addressing them by providing the mental health services that help keep students in school and learning. There are additional concerns we have about access to services for students as well. Our school counselors and school support staff are doing an amazing job, but they are simply overwhelmed by the increased needs during this pandemic. In addition, the mental health needs of the students are complex and some more severe, often requiring clinical specialties, family wraparound services, and approaches with community-based clinical providers, and that can help. Continuing the work that the Special Populations Subcommittee of the Behavioral Health Commission did, and with the partnership of Voices for Virginia's Children, and with the partnership of Senator McClellan, I'm carrying a budget amendment for the mentioned school-based mental health integration pilot for that $10 million to go to local school divisions to get support for community-based mental health services for students. Our children can't wait, and these collaborative approaches can help. The time is now because their futures depend on us to act. Thank you, and I'll turn it back to you.
Thank you, Delegate Price. I'd now like to introduce Annette Alston. Annette is a school-based provider, and she's here today with us to share her perspective. Annette.
Good morning, everyone. Thank you for having us. Thank you for inviting Child Savers to be a part of such an important forum to address the well-being of our mental health children, our children for mental health. And I would be remiss if I didn't share the mission of Child Savers, which is to guide our community's children through life's critical moments with trauma-informed mental health and child development services. I agree with Delegate Price that the mental health needs of our children is very complex. Things that I have noticed since I've been into the school regarding our children is that some of the challenges are trauma, community violence, violence in the home, depression, anxiety, suicidal and homicidal thoughts. We have absent parents, be that incarcerated or emotionally absent, because we also have a lot of parents who have untreated mental health illnesses. And also community violence, which often moves into incarceration. Being in a school, I've also noticed that restorative justice really is not practiced. School conflicts, they just spill over into the community environment as well. I see adultification, young people who are working to support their families, households, which contribute to attendance issues. Sometimes the choice is either work or school. Young adults are feeling responsible for their parents and for their siblings. And we also have youth that we're working with in the foster care and residential homes. Some of the challenges that I've also seen is scheduling. And in the high school and middle school, it's either you're trying to select from core classes and those elective classes. And sometimes with the challenges of the pandemic, with the shortage of the staff, you have students that may be placed in other classes. So sometimes you're trying to find those students which have been placed in other classes. Stigma, of course, peers and sometimes adult where, you're crazy and really not understanding the serious mental health, how serious mental health really is. And I always say, just as we have stomach pains, we may go to the doctor to get checked on for that. We have mental health pains as well. And also stigma can be perpetuated by our adults, our teachers and our parents. And it's, it's hard to break that cycle of generational trauma. And then sometimes in some families, children are afraid to speak because the mindset is what happens in this house stays in this house. So one of the things I think that could actually help would be to try to incorporate mental health breaks into the core class schedule. Being able to do that, I think, would also benefit for attendance. That would eliminate some of the truancy. We have kids sometimes when they're placed in other classes, they feel that there's no need to come to class and come to school because what is the purpose if I'm not going to do anything? An example is yesterday, I had a student who reached out to me early yesterday morning and asked if I was in. And I said, yes. And I said, are you in school? And she said, yes. I said, okay. And she said, yes, the only reason I came so that I could talk with you. She was having a bad day an hour after she had arrived at school. So I think that the benefits of what I've noticed also with children who's able to receive this therapy is they learn those coping skills. They're learning how to manage those challenges that are completely beyond their control. Students often feel like there's no light at the end of the tunnel. And once students finally realize there's someone who validates their feelings and also realize there's a very shortage across the mental health field altogether. Thank you.
Thank you so very much. Before we open it up for questions, I just want to take a moment to again thank all of the speakers. Melissa, a very special heartfelt thank you to you for sharing your story. We are grateful, and again, we want you to know that you were heard and you're making a significant difference. So now we will open it up for questions.
I have a question. Many of you touched on this $10 million budget amendment. I understand that broadly it is for school-based mental health resources, but can you talk a little bit more about what that would practically change? What do you see the difference being for somebody at the ground level for that money?
I can tap in. One of the things that I've noticed with a Newport News-based school that I went to, there are needs and concerns that more one-on-one treatment and a lot of time need to be devoted in order to get the student to a place where they can be successful in their classes. And with the student load and also with the services that are provided, it just wasn't meeting the need of the student. And so they were able to, with a local grant, tap into some of the clinical specialists that were in the community and ask for that help to get it for that student. And I think the 10 million would be important so that the local school divisions could augment what they're already doing, the great work they're already doing, but help add some power and some force behind it to reinforce it for the students so that they can get exactly what it is they need in order to be successful.
And specifically, the $10 million is for grants to help with the school divisions in a number of ways. It could be to provide technical assistance to specific school divisions that may need more guidance on how to integrate mental health services into the school day or into the school system. It could be to make grants available for a local school division to contract with community-based mental health services if they don't have enough counselors or behavioral health specialists in the local school division, and to help supplement those areas where they haven't been able to fund enough behavioral health specialists or clinicians in specific schools that have higher mental health needs. So it really, what it'll change is providing more flexibility and funding to help specific school divisions meet mental health service needs in their specific schools.
Just a follow up too, is it obviously there are challenges in terms of paying for mental health care, and I think often schools kind of serve as that, I guess, middle ground where you can access services and that's more equitable to everybody. So what in the case where the student is accessing care through the school, that's coming at no cost to them, even if they're contracting through a community provider, right?
Typically, yes. And I want to also emphasize, often it's the school that first notices there's an issue. Our students are in school a significant portion of the day, and often it'll be an incident that happens at school that is the first sign there might be something going on. For ADHD, anxiety, even depression, sometimes that begins to manifest itself in behavior at school. And so it's important to understand that you need to have school-based services because that's where the the kids are a majority of the day. But again, as you mentioned, it's equitable when it is a part of the community. It is a building where the kids are going to be a lot easier to get to and get services there rather than having to go to an off-site clinic or off-site provider that may be miles away.
Other thoughts or questions?
Yes, good morning. This is Brendan King with CBS6. Thank you so much for this opportunity. I appreciate it. I know that you all can offer a lot of money and funding to schools, but of course the workforce, I feel like the labor workforce has been impacted by the pandemic so much. So are you confident that you have the number, like the bodies behind that money to be able to help the children across the state, especially in like rural areas?
I'll address that. You're exactly right. That's an issue as well. And there are other budget amendments and other efforts to try to specifically address the workforce challenges for healthcare workers in general and mental health providers specifically. And it's important to remember we cannot look at these issues in a silo. because just as our students and our families are seeing more mental health challenges, our mental health providers are seeing more challenges as well. So this is going to take a holistic approach, and there are other methods to try to address the workforce shortages directly through the budget or other means.
And I'll just add that prior to this session, the work that Delegate Brewer and I were doing on the Behavioral Health Commission, we were able to put forth some recommendations with the Department of Behavioral Health and Developmental Services in using CARES Act funding and ARPA funding, and just want to underscore how extremely important that funding was, but it didn't always go to the private providers that can be helped with additional assistance, like what we're trying to do through the budget.
Hi, I'm Bela Sood, and I am a child and adolescent psychiatrist who served the Commonwealth for the past 34 years. And I would just like to follow up on Senator McClellan's statement about the inequity and the disparity in how the funding for children's mental health has worked over the years, and that's very prominent. And I'd just like to kind of talk about how we're going to look at the inequity in the different communities within the state, so that we don't end up having the rich becoming richer, and to really pass out the resources equitably, even among rural communities, as well as metropolitan areas, which does have a better ratio of providers for mental health services. So I'm just wondering how the public mental health system, as well as the private providers, can be equitably given resources in the state, so that we don't end up having the same problem of rural versus urban areas, and having areas where children just don't have any resources at all.
Sorry to keep jumping in, but again, at the Behavioral Health Commission, the last 3 meetings that we had of the full commission, that question was raised, and the dedication to making sure that the resources were done in an equitable way, supporting the communities, both rural and urban, that may need some more support. That was a promise given to us on behalf of the commissioner, and so now we just need to make sure that that we follow through with that. The other is some of the work that we're doing. I can't speak to who the senator was, but I know on both sides, making sure that there is ample oversight in how the systems are working with providers who live in the communities that are underserved, to make sure that we're not having, let me say, extra obstacles within the insurance coverage or networking and eligibility and all of that, so that we're actually diminishing the number of providers of color that are available in communities of color. And so I think if we work on both of those fronts, we'll continue to make sure and watch to make sure that exactly what you've described is what happens.
I would add what we saw in looking across the country in terms of children in need of help in their recovery journey through services with substance use disorder. They were having the most success at the most expensive treatment facilities, and they would often have to leave the state and travel. So there's a huge disparity between families who have higher incomes and lower incomes and their access. And then what you would also see are higher income families' ability to pay for their children to take catch-up courses so that they could get back on track to graduate on time. And so, really looking at, as an example of the Recovery High School regional approach, and we included funding for transportation to eliminate that as a barrier for kids who don't have parents who can get them to and from specialty schools, really ensuring that there's high quality access for all children, so that they have that peer support and there's access. So a model that we looked at from other places for that very issue about equity and how to be successful in your journey of recovery.
This is Emily with the Voices. I'm the Chief Policy Officer. I just wanted to weave in some of the comments that are in the chat and bring up some examples from our partners. We have Mindy Carlin, who's with the Virginia Association of Community-Based Providers, has raised Medicaid as one of the abilities to have some of the equalizers of access in the system across public and private agencies. There are several budget amendments that would increase Medicaid reimbursement rates for the home and community-based services that kids receive, as well as residential services and peer recovery services. So we're supporting those budget amendments as well that will help improve the whole system. And I also wanted to point out that that we have the Virginia Healthcare Foundation on here, who has proposed a pilot initiative that's in the Governor Northam's introduced budget that will help cover some of the time period that folks are on their path to licensure, so that that time that they are in the supervisory time period can be covered and paid for rather than out of their pockets, and hopefully get folks into licensed services and address some of those workforce shortages immediately. I also wanted to recognize the idea that we're hoping to innovate in this space and pilot new ideas. One of the reasons why we're lifting up the integration between school-based services and kids is that we've seen the success of the integration of health care settings-based services through the Virginia Mental Health Access Project. We have Sandy Chung here from the Virginia American Academy of Pediatrics, who helped to bring that program to Virginia, where primary healthcare providers, pediatricians are getting more training on mental health services, so that in those healthcare settings, kids have more access. We want to keep growing that idea by doing more of the integrated services in the school-based settings too. So I just wanted to call out our friends here who are also providing great services and advocacy for kids across the state as well.
Thank you, Emily.
And
This is Debbie Oswalt, and I just wanted to give a little specifics to the pilot initiative that you just described that is in the budget. And essentially, it would result in accelerating the licensure of 100 more MSWs to become LCSWs and 100 more Masters of Counseling graduates to become LPCs, simply by paying for the supervision required before they can sit for their licensure exam.
I'd like to comment. This is Robert Bolling. I'm the CEO of Child Savers, a child mental health provider in the city of Richmond and the region in Central Virginia. And I put in the chat that even with all these efforts to increase the workforce, it is critical that we address this issue around paneling of clinicians with insurers providing services, is that we can't be reimbursed for those services because the insurance companies are not including our clinical staff in their insured provider pool. So that issue has to be clarified, and it can be a simple solution, as simple as once you're licensed in the state, the requirements for paneling should mirror that license, the licensing requirements, and move that process forward. Sometimes it can take over a year. We won't get paid for almost a year. Significant issue. Thanks.
And this is Dr. Sandy Chung. I'm a pediatrician and medical director of the Virginia Mental Health Access Program. And it's certainly true that even prior to the pandemic, there was a crisis situation regarding mental health in children and adolescents, with suicide being the second leading cause of death of individuals between ages 10 and 24. And so programs like the Virginia Mental Health Access Program and the school-based programs, I think, are essential, because what our goal is to reach children where they are. So if they're in school, if they're at their pediatricians or seeing their doctors, wherever they happen to be, we should be able to get them help. And so again, all of these programs are so essential in order to help solve this crisis. So thank you all for your support.
Thank you all. Any other thoughts or questions?
I had a quick clarifying question. Is the 10 million one-time funding, or is it ongoing?
So the budget amendment, it would be for 10 million for each part of the biennium, and then we will look to future bienniums to do the same.
I'm sorry, 10 million.
And I also,
over 2 years, it's 10 million, or 20 million over 2 years
Per year.
per year. Okay, gotcha.
Other questions? Sheri, do you have any final thoughts? If not, I will close.
I will just say thank you everyone for participating. For any reporters, I see Jackie, Brandon, I also spotted you as well. As I said before, we'll have a recording available, so just hit me up afterwards and we'll be able to provide that for you when it's available.
Again, we want to thank everybody for joining us today, and a very special thank you to all of our speakers. Should you have any questions as a follow-up, please don't hesitate to get in touch with us. We'd be happy to either answer your questions or connect you with the right person.